So under the Wolf administration, there's been a renewed focus, from my perspective, on healthcare innovation, ranging from the Innovation Center to the SIM proposal to other initiatives, including, I think, some focus on rural healthcare, which is obviously very important here in Pennsylvania. So I'm wondering how you foresee these efforts impacting the future plans of the insurance department.
So the insurance department has been leading efforts as part of the governor's overall innovation agenda. We've been leading efforts around price and quality transparency. So I chaired a work group looking at how do we in the Commonwealth do a better job of providing information and making information transparent around healthcare costs and quality of care. Our focus has really been primarily making good information available to consumers so they can make an educated and informed decision about their healthcare. Going forward, I think what we're going to be doing at the insurance department is taking what we've learned from the conversations we've had so far with stakeholders around the Commonwealth and focusing on some key areas like health literacy, for example. We're going to be focusing on and continuing conversations around an all-payer, all-claims database. We're going to be having conversations around primary care quality metrics, as well as transparency tools that might help us do a better job of making sure there's good information available to consumers. So those are kind of the areas of focus, and I'm excited because we're going to be bringing somebody on full time to the department whose focus is really going to be to continue moving these efforts forward. I think we have some really good momentum. We've brought some really good people around the Commonwealth together to help us think about these things, and I don't want to lose that momentum. So we're going to have somebody who's really just focused on moving the ball forward. I think, consumers today they're more engaged than they've ever been because they have to be. They've got a lot more skin in the game. They are paying a lot more out of pocket for their care. So it's really critical for us, I think, as a Commonwealth to figure out how do we do a better job of making sure consumers have access to the information about healthcare, both quality and cost, that they need so they can make the best decisions for themselves and their families.